Hello and welcome. I'm Joanna Junak and this is GFN News on GFN.tv. Recently, Dr. Colin Mendelsohn, a leading Australian academic researcher in tobacco treatment, gave evidence at the New South Wales Parliamentary Inquiry into vaping. Later on, Colin, in his blog, covered a key major concern about Australia's vaping policy and commented on the blatant misinformation presented to the inquiry. Let's hear what he has to say.
Look, I'd like to make 3 points. Firstly, the current de facto ban is not working and it will not work with the proposed changes. 90% of current vapers have rejected the legal pathway and only a small number of doctors are willing to prescribe nicotine. This has predictably created a thriving and dangerous black market controlled by criminal networks selling high nicotine, unregulated products. And there's been escalating violence with that. This has also been the key driver of youth vaping. And history's shown that further enforcement and border control has minimal effect on the supply of illicit drugs. The only way to significantly reduce a black market is to replace it with a legal, regulated one. Vapes should be sold as adult consumer products from licensed retail outlets with strict age verification, like cigarettes and alcohol. My second point is we haven't got the balance right between protecting youth and helping adult smokers. In Australia, vaping policy is driven by a moral panic about the relatively small harm to a small number of young people. But we also need to remember that smoking is the leading preventable cause of death and illness in Australia, and vaping is the most effective and the most popular quitting aid. And vaping is a huge opportunity for public health. And policies that make vaping less accessible, less appealing, less effective will keep people smoking. Thirdly, I've been appalled by some of the misinformation presented to the committee in the first hearing and in some of the submissions. Just to give a few quick examples, there's no good evidence that vaping is a gateway to smoking. In fact, the evidence suggests that vaping is diverting young people away from smoking overall. Secondly, there's no evidence that vaping harms the human adolescent brain. Thirdly, vaping is not overwhelmingly used by youth, as some people have stated. Only 5% of Australia's vapers are under 18. And finally, vaping is not risk-free, but it carries only a small fraction of the risk of smoking. The risk of cancer, for example, has been estimated to be less than 1% that of smoking. Thank you.
I might go to Dr. Mendelsohn first. You've stated publicly that you believe schools should consider allowing students who vape to leave the classroom to vape in designated area in school grounds. We know that there's lots of smokers and vapers that have gone all around the world in aircraft that can't smoke for a long period of time. So why do you then appear to believe that kids who vape can't wait till after school hours to actually vape?
Because, Senator, that's what we're constantly hearing from schools, that kids are disrupted in the classroom because of nicotine dependence. So there are a number of kids, not that many, according to the research, that can't last right through a class session, or can't last through the whole day without going into nicotine withdrawal. And that seems compassionate and pragmatic to me to relieve those symptoms. I mean, obviously they need to have their addiction and their vaping behaviour discussed, and ideally they should be quitting, but some won't. And I think it's compassionate that we should allow them to relieve those symptoms until they can leave this school area.
So just on that, I mean, all vapes that children are smoking in school have been illegally retailed, obviously. So you think it's compassionate to allow children to vape to leave the classroom. Do you believe that schools should be compassionate and allow kids who are users of other illegal drugs to actually leave the classroom to use them?
I'm not talking about other drugs, Senator. My specialty is
but I'm
and nicotine.
drawing a comparison. We're talking about illegal drugs, illegal substances.
I don't think in this case, in the case of nicotine, I don't think it makes any difference. If those kids go and use nicotine gum or nicotine lozenges, I'm fine with that. I think we need to relieve their nicotine addiction, and it's causing disruption in the classroom. It's unpleasant for them, and I think that's a compassionate approach. I'd much rather they.
You're a strong supporter of flavours in vapes. Do you agree that there's no example anywhere in the world of an inhalable therapeutic drug that contains flavorant chemicals? I know there's around, I think it's about 2.6 million Australians have asthma, yet their life-saving puffer drugs are not flavoured. So why do you think...
I'm very aware of...
Sorry,
yes, I'm very aware of...
Sorry,
go ahead.
If I could just
go
finish.
ahead, sorry.
Dr. Mendelson, we do need to let the senators finish their questions.
Sorry, I beg your pardon.
Provide you the same courtesy, thanks.
So why do you believe that vape should be unique in allowing non-safety assessed flavours to be somewhere above such regulatory oversight?
Thank you, Senator. Look, I'm very aware of Professor Chapman's arguments in this area.
No, these are questions I'm asking.
Thank you. And my answer is that there's very strong evidence that vaping, flavours are a very important part of the appeal of vaping. If we want smokers to switch to vaping, the products need to be appealing, and flavours give them an incentive to switch. Not only that, they increase the likelihood that vaping will be successful. They're associated with a reduction in relapse. And the research shows from various jurisdictions that if you remove flavours, these products are not only less successful, but people find workarounds. They add their own flavours, they go to the black market to get flavours, and some of them return to smoking. So I think flavours play a very important role in helping smokers to make the switch. They weren't vaping in the first place, but realistically they will be.
Here we go. Dr. Mendelson, interesting testimony. What your model looks like is a lot like New Zealand. There has been some conversation about New Zealand youth vaping is rampant. What's your experience or knowledge about that?
I think it's more nuanced than that, Senator. The New Zealand daily vaping rate amongst the 14 and 15-year-olds in the ASH survey has gone up to 10%, which is 3 times the Australian rate. But most of that rise occurred before vaping was legalised. So there was a free market until 2020, and vaping rates were rising. They rose to a peak just after the legislation. They've now levelled out, and it's likely they're going to start falling soon. What's more important is that daily smoking amongst young people has fallen to 1%. And so smoking has almost disappeared, and as vaping rates have risen, smoking rates in young people have fallen faster than ever. And that's the advantage of vaping in young people. We're not encouraging young people to vape, but the evidence is clearly showing that in the age groups that are vaping, their smoking rates are falling, accelerating downwards.